on this train of discussion. Once men have their treatment, whether it be radiation or surgery or cryotherapy, how soon do you start evaluating and treating them for their incontinence and their erectile dysfunction?
Well, I think almost immediately in some respects is the right answer. And even beforehand, we talked about some of the preemptive things that can be done. Um, I would say though, typically from my standpoint, when I tend to see men, it's after they've already tried potentially medications, when they've already tried physical therapy, which I think is an important tool for every man who undergoes prostate cancer therapy. When I talk to men about surgical therapy, and I'll just go from that route because it's what I have expertise in. Oftentimes, we won't necessarily think a man's ready or offer surgery for at the earliest 9 months or up to 12 months after their treatment is completed for their prostate cancer, because we do see that while rates initially of urinary leakage may be high in the first month or two after radical prostatectomy, for example, many of those men will go on to regain or at least significantly improve the level of incontinence, and they may not end up needing a surgical procedure. But to be more direct about your initial question too, I'd say it's important to get involved with treatment and evaluation of that quite soon within the first month or two, because men can also benefit from other interventions besides surgery to help hopefully have them avoid it.
And I know before you did mention two things. One is a role of behavior modification, whether it be dietary, lifestyle modifications. And also you mentioned kind of like expectations, realistic versus unrealistic, or actually how some expectations are important to some individuals and really not important to others. And so it's really important to ferret those out in your history taking and how you proceed. So that was really helpful what you brought up before. And I just thought I'd bring it back again.